you kind of go into medicine with these lofty ideas of wanting to save the world and help everyone out there. And then at the end of the day, you're really helping like one patient at a time. It's not all rainbows and butterflies.
This podcast is brought to you by Feel Confident. For the best-in-class skincare and hair care, make sure to check out feelconfident.com. Dr. Austin Chiang was my medical school classmate. He's now a triple board certified gastroenterologist, and he's the assistant professor of medicine at an academic hospital in Philadelphia and the director of their endoscopic weight loss program. He's the chief medical officer of Medtronic's endoscopy division, and he's on the YouTube Health Advisory Board. He's been to the White House several times talking about healthcare and social media, and he's now an author of a book that's called Gut: An Owner's Guide. It's with great pleasure that I'm here with Austin today. All right, so this is us back in 2007, 17 years ago. This is what I pulled up from Facebook.
Wow.
You remember those days?
We were so young. Was this is like at the very, very beginning of med school, right?
Yeah. It was like
probably
MS1.
Orientation week, maybe something
Probably.
like that.
But they let us have like 6 weeks, I think, in between exams.
Yeah.
So I remember we used to go out quite a bit in the city.
Did. I loved going to med school here in the city because, whenever we did have a free moment, we could just step outside and there's always something awesome to do.
Yeah.
And just to think that at the time we were all in the same place in life, right? Kind of career-wise. And then we've all found our own path and everyone has gone on to do amazing things in their own right. It's wild to think that it's been this long and that so much has transpired. Wild. Yeah, like at that time, I don't really know what exactly was going through my head about like what I would do one day. I was just happy to like be in medical school. Like, yes. It was so much effort to get in, right? That I was happy, I wasn't really thinking about necessarily the next step. But of course, we all knew we had to like pick a field, a specialty. Mm-hmm. But if you told me at that time that Gary of that time would be doing hair transplants and, lip surgeries one day as like the primary focus of his clinical practice, I would have been like, you're crazy. Like there's no way. So when you think back to, Austin of that time, like what was going through your mind about maybe a future path and like, what are some similarities and differences with what you actually do today? I mean, I was so young and naive and I think, which is a good thing back then, because you kind of just focus on, all right, I have one thing that I need to work on, and that's med school. And I kept an open mind going into it. I think originally, right, we actually co-chaired, I think, a plastics interest group.
Yes.
And so you actually saw the vision through, and I went a whole different route. And I just kept an open mind as we were going through all our med school rotations, and I, tried everything out. And I was the type of student who liked everything, which made things really difficult. So in some ways, I think choosing internal medicine as my path was kind of a way to postpone that decision. I knew I wanted to subspecialize and kind of be an expert in a specific area. And so ultimately I kind of, thought I was going to go into critical care at one point, that I was going to go into cardiology, and then really landed on gastroenterology halfway through residency. So I made my decision pretty late. And part of that, so many different reasons. The variety of the field, how many organs are involved, the technology behind it, the culture of the people I was, around in that field. So yeah, I think back then I just kept an open mind and tried to soak it all in. And it's, just like you probably hear a lot of people say, we learn so much in med school and I don't remember so much of it because I've become so subspecialized. But I felt like that was just such a great time to know a little bit about everything and feel like you had a good grasp on, okay, this is how all the different fields sort of come together. I don't know. It was such a formative period in our lives.
Yeah, for sure. Yeah. I mean, there's definitely been this trend towards like hyper specialization. Yeah. But I wonder if like sometimes are we losing something as everyone just kind of is just within their narrow niche. And, you still need like someone to kind of oversee that, the process, that overall health process for someone. And I guess we have primary care doctors for that. But then with the explosion of information, I feel like maybe sometimes they don't even know, all the different options that exist for somebody as far as like treatments they can get. And so it's interesting, right? As we get like really, really into just one narrow thing. And then also for just the way that the practice looks like, there's a lot of different skills that I've, been able to garner over the years with like, ENT, head and neck surgery, then facial plastics and trauma and all this kind of stuff. And now I do just like a few different types of procedures. Is that like wasting certain skills? Like, I don't know, I think about some of this stuff.
It's hard for patients to navigate when there's so many different kinds of doctors out there and everyone's got their own, very niche focus. And yet at the same time, technology keeps on evolving and we have to learn more and more things. So we can't help but, try to be good at those specific areas. And I think some of the technologies can be very complex. And so it takes that much extra training to get there. And for us, I think it's hard because there's only so much time we can devote to training. Otherwise, we're, spending half our lives in school and in training. And so, yeah, it's a tough balance and to kind of get this whole health system to come together.
Yeah, what I realized at one point was like to offer people the highest level of service or, like of skill when it comes to specific procedures, like I had to be doing that all the time. And I had to know exactly the latest technology, how to use it, all of that. And that meant that I had to let other things go. And that was a tough realization. And I think a lot of people are okay with being pretty good to maybe very good at like lots of different types of things. I'm sure it's like that in GI. It's like that in, head and neck surgery. Like there are some, ENTs that do nice rhinoplasty and they do good sinus surgery and they can also take off a polyp off the vocal cord and great, and they're happy. They like the variety. But I think like if you want to be sort of like on par with the best, like internationally, not just like locally, you have to be doing the same stuff over and over and over. When I give people advice on like when they're trying to select, I don't know, a surgeon for a procedure, even if it's not something that I do, like my dad needed, to get a clot in his portal vein removed not that long ago. And I contacted you about that to get your thoughts. And so, but we ended up going with Mount Sinai for where to do it because they had like just the greatest number of cases over the course of the past year, So we went with like the high volume facility for that type of procedure. So yeah, I mean, that's kind of how I see it. If you want to be the best at something, like you kind of have to do it like at least weekly, I think.
Yeah.
If not even more often than that.
Yeah, it's a challenge. I think, like I said, we're so subspecialized now. I went through basically GI fellowship, advanced endoscopy fellowship, which is a subspecialty of that. And then even within that used to be kind of like the final step. And then now there's like further subspecialization. And I have like this niche in weight loss endoscopy, but that means I can't do other things because there's only so much, that you can learn and spend time kind of refining. But yeah, it's I agree. I think you got to go to the people who are doing it the most. And our careers also evolve too, right? Like over time, there may be different needs that patients have, and then we kind of serve those needs. Just wild to think that everyone, I don't even know like what everyone specifically is doing these days, to be honest with you, because it's so hard to keep in touch with everyone.
Yeah, and it's hard to keep track because people's, their career paths change a bit. We know people who now they don't even do clinical medicine. They're working for insurance companies or other, big corporations, still doing something in the medical sphere, but like under a different type of umbrella. And that stuff changes. Sometimes people just realize that for whatever new phase of their life, like they just want to try something else. So.
Honestly, I think it's a good thing because there aren't enough doctors in other parts of the healthcare system. And you kind of want the doctor input in different parts of that, because otherwise, things just move more slowly when people don't know what's actually happening on the ground in terms of patient care. So I'm glad to see that there are people working in pharmaceuticals and health policy and consulting and things like that. So, yeah.
And just to have people honestly do things that maybe they enjoy, more than seeing patients or operating or whatever it is. I think we're on this almost like conveyor belt for a long time in medical training. And there's a point where you can hop off. And when you reach that point, you make that decision potentially, and hopefully, you're happier for it. And you can always change back. For most people, you can change back, but it's worth trying. If someone's in, clinical medicine and they're just not really enjoying it, but because I think, look, we shadow people right before medical school or during medical school, and everything seems cool. But when you're in it and you're doing it and you have to deal with potential complications or unhappy patients or the paperwork or the computer work for notes and just, different administrative headaches at a hospital or what have you, you start to realize maybe that there's something else out there where I could just be happier.
Yeah.
And so I don't know. So any advice for medical students that are kind of going through this now, or people looking to maybe go to medical school that you have with, I guess, all of this in mind as they start to think about career paths?
Yeah. I mean, as somebody who is in a hybrid career myself these days, I try to, whenever I can, I try to give talks about, my role and kind of insights from my other job in on the corporate side, on the medical device side. But I just encourage people to just keep an open mind and also explore things healthcare adjacent, or I should say patient care adjacent, because there are a lot of opportunities, and I think physician voices are very valuable in those areas. And so just keep talking to people. It's not something that we're used to in medicine, where we talk to people outside of our kind of usual medicine bubble. Everyone is stuck in their own specialty and meeting people as they should and networking within that. But then also I would encourage everyone to spend more time talking to others around this immediate bubble, because then you may come across a cool opportunity. And in some ways, what you're doing, on social media is a kind of a different path as well. And it's important though, because kind of the messaging that you have out there for patients, education, I think it's making a difference.
Yeah, no, I think it's a good point. I talked to some of my parents' friends who are, physicians. They've been doctors for many, many decades. To them, they think of success as having multiple office practice locations. A bunch of them are in private practice. And recently, one of them was so how many offices do you have? He said to me, I'm I just have one. And he was oh, okay. He's I have 4. And I'm okay.
Why is it a competition?
I'm yeah. You're 70 years old. I don't, but also I'm and I didn't really even want to go through the whole explanation of what else I'm doing, in that, just expanding my clinical practice is not really my goal right now. Mm-hmm. I didn't think he would understand, all of the other social media stuff and online stuff, and creating a whole new brand and products, and it's just different. I think it's something that really wasn't an option at the time that, for example, that one doctor I'm thinking of, when he was going through his training, or when he finished his training, it was just you just go, you either join a hospital, you join a private practice, and you just see patients and you do the things that you were taught. But now, like you said, there's kind of an explosion of opportunities for people, I think, in med school, or thinking about just find out what else is out there, and you can carve your own path. And it's hard also, when you do have to still get through medical school and through a training program, it's hard to think well, what exactly am I going to be doing? Because then the opportunities might change. There might be new things, new interesting, paths. But just knowing that all of that is possible, and you're not stuck. I think that's right where people, sometimes get, I don't know, you could say depressed. I mean, look, there's a high suicide rate, and amongst doctors, we can't forget about that. But I think a lot of it stems from just feeling stuck.
Yes,
maybe it's family that wouldn't want you to change paths, or you might feel just a failure if you're not doing the thing that you trained for years and years to do. But just reminding people that you're never really fully stuck. You have these skills and talents, and then you can apply them in different ways.
You can totally diversify your career. There's so many different opportunities out there, and I think that one of my frustrations, I think, is, and maybe a lot of people who go into medicine share the same feeling, is that you kind of go into medicine with these lofty ideas of wanting to save the world and help everyone out there. And then at the end of the day, you're really helping one patient at a time, which is very gratifying and important. But I think personally, I felt this desire to do something more at a population level. And I often feel like my own social media kind of work over the past decade has been kind of an outlet for that. And so finally, when I got the medical device opportunity, I felt this was a tangible way of actually potentially having an impact on millions of people at a time. And so, you know, diversifying your career and being able to do these other things and fulfilling those other goals and desires, I think is really important. You might be busy, but I feel like I'm even busier now than I was when I was full-time in practice. Mm-hmm. But it's interesting, right? I think I can, when I'm tired and frustrated with one aspect of my life, I can like shift to something else. Whereas, yeah, I think like a lot of people feel that sort of burnout because they feel stuck. But I think, you know, with everything you're doing, for instance, it's a lot of work. I don't know if people realize that everything that you're doing with like the social media piece and, you know, your line of products, I was telling you before this that I'm just so impressed and proud at everything you've achieved.
Well, feeling is mutual, honestly, Austin. I mean, it's like, you know, we were talking about this when you first came by the office, and, you know, it's like, I look to you and, you know, people like you for inspiration, you know, and motivation to kind of keep going, because you don't want to feel like this kind of like lonely island and like I'm on my own trying to like do all these things. Like, it's great to see people not just, you know, achieving something great, but like excelling what feels to me like beyond what I'm doing, you know. Like, I see you have all these invitations to the White House and I'm like, whoa, like Austin's off to the White House again, you know. It's like, I don't know, to me it seems like incredibly impressive, and it is. And then all these other things, now the book, you know. So listen, one person can't do it all, but when you see someone else who's like achieving all these things, at least the way I see it, like, it motivates me to like continue to work hard. Same. You know, because someone else out there is doing that in their own way. And I think like it's like that probably in sports as well. You know, I think like when someone's really like a great athlete, even within their own sport and probably other sports, like, you know, they respect, you know, someone else who's like kind of on a similar level and doing great things and winning championships and whatever else is the equivalent in that world. So.
Well, I mean, I think back again, thinking back to like when we were in school, and I was just imagining like those times where we didn't know what the future would hold for us. And all we knew was, okay, we just got to put our head down and grind and study in the library for hours on end and hope that something would work out. And I'd say that you and I have done pretty well so far. And really everyone in our class that I, you know, have kept tabs on, I feel like everyone's done amazing things. And back then we just didn't know what was to come, and we just kind of had to trust the process. And so I would also say for any students out there who feel frustrated, what I told myself back then was that there were thousands of students who had gone through the process before. Mm-hmm. And if there were that many people who've done it, I could do it too. And so that's kind of how I kept myself going through it. And sure enough, I think, you know, I'm glad that we've all ended up like this. And, you know, also the fact that in med school and beyond that, in residency and all throughout training, and even now, I feel like we do rely on each other a lot. And, you know, I turn to a lot of my colleagues for professional help, just not only on the technical side, but also like emotionally and just figuring out, okay, am I thinking about this the right way? And we were in the trenches together for a while, but I feel like that bond has carried forward in a lot of ways.
Yeah, for sure. And also I think it's really important to continue to check in with yourself throughout this process of medical school training, after medical school. It's easy to get lost in like what sort of everyone else has done before you and is doing around you. Sort of checking in and being like, is this still making me happy? Am I enjoying this? I think is really important. And that was one of those things that for me about a year and a half ago, when I decided to move away from certain surgeries that I was trained in and that I was overall getting nice results in, when I was performing and patients were overall very happy, to say like, kind of very artificially, to say I'm just going to stop offering these when we have like a long list of people signed up for consultations. Anyone signed up for the actual surgeries we took care of and they did well, but anyone who just had like for some of those people, it was like literally like the following week there was like a consultation for like a facelift. We called him and said, look, he's not offering this anymore. But part of that decision making had to do with like thinking introspectively into like, well, like what actually makes me happy? Like what types of procedures do I stress out less, doing them and preparing for them, and still give me like a nice reward emotionally and then financially too. So that kind of check-in process, at least at that point, I just remember it so distinctly, wasn't that long ago, was really important for me to kind of like guide my next steps, beyond that time point. It's hard when you're like in, especially residency, you're just kind of doing whatever is asked of you, right? And that's all you can do, and you're achieving that. And then fellowship is like more of the same, and then you finish and you do have this feeling of like, well, I just learned all these things, like this is what I should be doing, like and then to do those things and then decide to try something else, that's kind of like a scary leap. I mean,
I think what's really difficult is that we're all fed a certain image of success, and I think, to your point, like asking yourself what makes you happy, how you define success is really important. Like what you were saying earlier about people having multiple practices or multiple, sites or whatever, or being the big name academically and publishing a lot of papers. Like everyone has a different, like as time has gone on, I feel like we've all defined success differently. In med school, it's hard to step outside of that because I feel like you're surrounded by academic faculty. Most of them are in academia and they have that definition of success, but that might not be true once you step outside on your own. Sometimes success is just doing the procedures that you really love and, providing a great service to patients. Sometimes it's making a lot of money. And I think that there's, inherently not something wrong with that for some people, but that looks different for everyone. And others, it's like, okay, how many patients can I touch over the course of my lifetime? And defining that, I think that's put things into perspective for me when I look at other people's careers and how glamorous something looks, or how glamorous someone else's life looks. That might not be right for me. And I know that often what comes with like the glitz and glam is a lot of hardship and a lot of other, responsibility and trouble. And I think when I was in med school, there was actually one, I want to say it was a psychiatry attending when I was on that rotation, who actually took us all out to dinner. I don't know if you had the same guy. But I remember
no one took me out to dinner. I don't remember
different
that.
rotation.
Yeah.
But yeah, for our rotation group, he took us all out and he said, let me just put things in perspective. Ask me anything you want. I'm an open book. And we really like drilled in on like all aspects of his career and his family life and what made him happy. And I think that was, I keep going back to it because that's like, was really impactful in helping me think about, okay, maybe my career, it's not kind of what I imagined success to be initially, because a lot of the money and status and things like that society tells us is success comes with a lot of other things that might not be so pleasant. It's funny because sometimes I also get asked now, like, oh, like you seem to be doing so many things and you seem to like, have it all. And I'm like, well, it comes with a lot of sacrifice. Like, I don't really sugarcoat it anymore. I'm like, I've had to lose hours of sleep, for long periods of time, or if it's been frustrating and it's taken a toll on my mental health sometimes to like get it all done. And so it's just it's not all rainbows and butterflies.
Yeah, no, thanks, Austin, for the honesty. I remember talking to Ryan Einstein, who I mentioned was here like a few weeks ago, about that. And that's like a big thing that he talks about is like, how much are you willing to give up for success or, perceived success? Yeah. And that's a big part of, I think, entrepreneurship, and even, I guess, if you're like, just working really hard for a corporation, it's not necessarily, you're not an entrepreneur per se, but if you're trying to grow within that organization, you still are giving up a lot. And a lot of people are not okay with that, and like there are times when I'm like, oh, I heard about some Netflix special, and I want to watch it. And then I'm like, well, if I watch that tonight, what am I not getting done that I'm supposed to get done? And there's always a long list of things. And then I'm like, well, I guess I shouldn't watch it, And so it's one of these things where like, I also want to relax and watch something fun, but I just realized like I need to still do the stuff that, is kind of moving everything forward. It's hard. And then other people they don't need any of that. There's a podcast I watch on YouTube, Colin and Samir. And, those guys are cool. So on the podcast, they had, I think it was Matt Pat and his wife on one of the episodes. And they're talking about how there's this like almost like inverse correlation for jobs where it's like happiness versus interestingness. So it's not like you're happy or unhappy, but if you have like a really interesting job, like probably many would say that what we do is kind of interesting, like it's diversified, it's not the same thing every day, and yet, we're like experts in our areas, but we're doing like other stuff, right? So that's really interesting. But like, are we always the happiest? Like someone who has a much less interesting job, maybe has a 9 to 5, where they go in, everything is very predictable. They're answering some phone calls, very routine, maybe lower stress. Maybe on an average day, they might be happier and less stressed and all of that, but maybe it's not as interesting. Yeah. So I thought that was like a pretty cool sort of like comparison.
Yeah, I think it's just different for everyone and kind of what they, enjoy and what they tolerate and put up with. Everyone just has different priorities, and those priorities shift, right? Like, I think when you have a family, I know for a lot of my friends who like start a family, their priorities shift, and that changes the course of like where their career is going, and they have to make trade-offs and sacrifices. Yeah. But when I go back to med school, I think about, I'm very grateful that I was here in New York, because like I was saying earlier, on the rare times that we have like a free moment off, I can just step outside and do something cool. And I tried to like grab those moments as much as I could. And I feel like if I had gone to med school somewhere else, maybe it'd be a little more difficult to like go to a TV show taping or something, which I did like a couple times in med school, which is awesome. Yeah.
Cool. When it comes to YouTube, I make all these videos on YouTube, and I know that there's this like YouTube health advisory board, and they invited you, right, to be on that. If you can just give me a sense of like what you guys do on that board and like what you think maybe the future for like YouTube health is. Yeah.
So I occasionally contribute as part of that board. Part of what we had been focusing on was sort of misinformation tools. So how to direct viewers in, towards more accurate information. And I know you have a label where it says that you're kind of a board certified, licensed professional. And we've had to apply to get that sort of label. And that conversation actually came from the activities of this board.
That's a great idea.
Yes, because I think that especially the pandemic, I think highlighted the fact that there's a lot of misinformation online, and how do we make sure that people are actually going to appropriate, credible sources without censoring, what people are talking about online, because sometimes it can be very gray, especially because medicine is not perfect and we're always discovering new things. But yeah, tools like that sort of came about because of all these conversations we had.
Interesting. And any other features or anything else that you can reveal about like what might be coming for I guess more of that?
Yeah, I mean, I think that some people might have noticed like a health shelf, like when they go to their homepage, if they're looking up a lot of health information. And so they're recommended specific videos, obviously based on the algorithm and whatnot. But that way, like the videos that are shown are, from some of these credible sources. But yeah, a lot of the people who are on this board are people you probably know, your viewers know. And part of the reason why I was on it was because I used to also regularly create YouTube videos, although I'm a little more dormant these days because there's a lot on my plate. But it's been an interesting process. And obviously, like, we're only just there to suggest and consult. And then ultimately they sort of decide what works best for the platform.
Yeah, I mean, in the hair space, there aren't too many other like hair surgeons who are making videos about, all these topics. And most of the information is coming from people who are, enthusiasts, I would say, of hair restoration, but they don't really have like the degrees behind them. They don't have real patients that they treat. And so while many of them are very like well educated in that space and give a lot of accurate information, there still are some limitations, for I think some of the conclusions that you can draw from at least some of the content there. And so I think it makes sense to like indicate that, hey, this person is actually board certified. I guess where it gets a little bit tricky is someone who's, just like a physician, an NMD, but maybe doesn't have the unique expertise within that narrow kind of field, and that might be harder to indicate, that this person's actually like a hair surgeon. That's most of what they do, versus, a dermatologist who's talking about hair but doesn't do hair surgery, versus, someone who's in internal medicine talking about hair, who, is even more kind of removed from seeing patients with those types of conditions. So that, again, kind of like that whole hyper specialization we were talking about, I wonder if eventually there'll be special indications on YouTube for that, because I know I sometimes will talk about certain, skin related conditions that maybe like I can talk about them, but I don't know as much as somebody else in certain things that's all they do in dermatology, let's say. So yeah, giving them that indication that this person has achieved that kind of higher level of within being like a physician, but then the next level up.
Yeah.
That might be
tough,
interesting. Yeah.
Because I feel like even taking a step back, I feel like sometimes it's also educating viewers that of the whole process. Like, what does it even mean to be board certified? Like, what does it mean to have undergone a fellowship? Like, I think it's not entirely clear, especially because there's so many different paths within medicine. Some specialties end at residency and some like require much more training. So it's just tough and nuanced, but that's sort of like what they're balancing. And I know, we've had different conversations before about like, how do we educate the public about that? Not just like putting a label on, but we'll see what else can come about of it.
Yeah, for sure. And then I know you've been to the White House a few times, right? So when you're there, and I know there's some conversation about social media, but like, how does that generally go? I mean, what kind of stuff is like coming out of those conversations, and how do you think that might impact kind of more like beyond, I guess, just YouTube?
Yeah, it's so broad. I mean, the specific reasons why I was there more recently were around the Cancer Moonshot initiative, and my role is more like on the colorectal cancer awareness side and just improving access. And I think that means a lot of different things, not only just access to doctors and access to procedures and screening and things like that, but from my point of view, it's also access to information. And so we kind of like weigh in as people who are involved in different areas within healthcare, what that means and what sort of maybe they can help out with, from the government side or legislative side. But yeah, it's just to kind of provide our perspective on things that they might not hear otherwise.
Before we leave the theme of social media, just wanted to say, Austin, how do you deal with some of the negativity that comes from being like a, social figure in your space? I mean, just people writing in comments, whether it's just misinformed comments about maybe specific, details, medical details that you've mentioned, or just, about the style of presentation or your appearance or whatever it is, because I surely get comments about all that stuff on a daily basis. So I wanted to see how you deal with some of that feedback.
I think over time you kind of are able to discern whether or not someone's just trolling you or if it's like something that's productive and constructive. I think that there have definitely been moments where, there have been videos I've put out where the feedback that I got was valid and I, took that into account and took the video down, or I had to like respond to it somehow. And then there's other times where, especially now after so many years of being on all the different platforms, where I kind of know like, okay, this isn't really going anywhere. My general approach is that there are people who are, even if you have like a specific opinion about medicine, especially like some of the more politicized topics these days, I think people take extremes and it's very hard to shift what, people's opinions are when you're on either end of those extremes. But there's a huge portion of the people in between who are genuinely curious and want to learn and have questions that are very valid. And I try to, engage with those people. And then of course, like if it sort of derails, then I sort of disengage, but it's not always easy or clear. But yeah, I think after having done it for a while, you probably can relate. You just kind of, you let it roll off your back a little bit.
Yeah. I just try to not read a lot of it, to be honest, but but it's tempting. And I usually every day will at least read some of the comments on like Instagram or YouTube, and I'll try to respond here and there. But I've definitely found that just looking at it less often is beneficial too. I mean, there are times when it's something constructive, but I feel like most of the negative stuff is just there by trolls to just try to, I don't know, bring you down or whatever.
We're human too.
Yeah.
You know?
Yeah,
like,
I know.
We've got feelings.
Yeah, there are occasionally comments that really get under my skin, and sometimes I'll just delete them, but like they'll just kind of like sit with me for a little while, and I definitely feel them affecting like my mood, you know.
Yeah.
They're just the way certain things are phrased. Like some things, you know, you've heard maybe a million times, but then they adjust the phrasing, and then, you know, they don't necessarily question, they don't make you necessarily question like what you believe, but I don't know, it's just like, I'm like, I can't believe like someone interpreted what I put out in that way. Like that's like a very distorted kind of way to take it, and now it'll just sit with me because I think at the end of the day, like you and I are kind of like, we do like to crowd please. I mean, we want people to learn something, to leave like, you know, happy with, you know, watching our stuff. And so when you really piss someone off and you're like, this was not meant to be taken that way. So there are times when I'm like,
I mean, I've learned a lot of lessons, and I'm concerned sometimes about if other people are reading the comments, if they're going to be misled by someone's comment in there, kind of trying to challenge me for no good reason. But yeah, like I said, there's been some valid scenarios where I've learned something from it and learned that maybe I should have phrased something differently, or I should have been more careful about what I said. And that's experience, right? Like that's sort of, it's informed how I create content now more than before. And yeah, I mean, I don't think I actively think about it that much, but it's certainly like it subconsciously goes through my mind as I'm making a new video or something like that.
Yeah. All right. Switching topics to the gut.
Okay.
Let's go over like your general definition for the gut microbiome, because I remember learning about this in medical school. You know, I feel like I understand generally what it is, but it's, you know, that terminology has been thrown around for years now, and I think many are confused. Like, what exactly is that? So
yeah, I feel like when we were in med school, the concept was just being introduced, like popularized, and even now there's still very little we know about it, or I should say little that we know is clinically impactful for patients. But basically what the gut microbiome is, or gut microbiota, is the population of bacteria that live in your colon, your intestines, that coexist with you. Those bacteria actually outnumber like our own cells, but we're just beginning to understand what impact that has on our health, and whether or not, you know, there's a way to target certain strains of bacteria. If there are certain strains of bacteria that are harming us in certain ways or affecting how our body functions, if we can target those for treatment one day. So it's an exciting field, but it's also like kind of a big mystery right now.
Yeah, like I saw this, it was from actually the Harvard public health school, which I think you got a master's from, right? This was from like last year. It's just a headline. It said like, the analysis found that people who suppressed their emotions had a less diverse gut microbiome. Like, I wonder if studies like that, like how causal they are versus like some correlation of, we found, you know, whatever, this type of bacteria, and then people's emotions may have been affected this way. But like, is it really that bacteria causing that? Or is it just like, you know, I don't know, a red herring? Like, I wonder how much, not just for a study like that, but just like in general, a lot of these, because I feel like the gut microbiome has been linked to so many different health conditions, mental health conditions, physical health conditions. How often do you feel like there's like a causal kind of relationship versus something just kind of correlational?
Yeah, I mean, it's so tough because, like you said, so much, there's a lot of associations that are being made out there, but it's not necessarily causal. And I think, you know, I think that there's some truth to some of it. We just haven't clarified it yet. And what's tough about that example is I feel like that gut-brain axis, you know, the relationship between the gut and the mind it's there. We know that there is like a connection there, But what exactly it is, like how it exactly works, I think is still a mystery too. So now you have two fields that are a mystery. You've got like the bacteria, and then you've got this gut-brain connection, and you're trying to say that one influences the other in some way, but we don't really know how. And even with this finding, like, let's say it is true, like, okay, then what can we do about it? Like it becomes a much bigger conversation. But that said, I think it's interesting. I can only imagine 10, 20 years from now, what we might discover or how we might be able to develop some sort of treatment. Like in that example, if we were able to kind of, reduce our stress in some way, is that going to somehow improve our gut microbiota and improve our health in some way? I don't know. We'll see.
Yeah, like you said, like there's so much of that bacteria, so many different types, and just the sheer quantity of it. Like I wonder if some of the newer like algorithmic processes are maybe helping some of that research.
Yeah, I can only imagine like the kind of work that's being done there. I feel like this is such a cool time in technology and healthcare, because AI in general, now that we have the computing power to run some of these really complex algorithms, I can only imagine the impact it's going to have on the gut microbiome and like our discovery of that. And kind of on the flip side, like even potential therapies there, because I know AI is being used in drug discovery and trying to figure out like what treatments can be applied to the problems out there. So yeah, I'm very, very excited about that.
Yeah, for sure. And I remember when I developed my alopecia universalis, lost all the hair on my body a few years back, I was looking at what are the different, treatment options. And this was before JAK inhibitors were actually approved for areata, for especially like more advanced areata. And one of the studies that was being done actually locally, I think it was Columbia or Mount Sinai, one of those, was on fecal transplants. And they did see that there were some people who had this extensive hair loss regained some of their hair just after doing a fecal transplant. And I remember trying to figure out like, how are they going to do this again? I remember there was like capsules versus like injecting some stuff. I don't know. So maybe you can like speak to like what kind of treatment that is and the different conditions that people get that for?
Yeah, so usually the only time that we typically do it in practice is for people who have recurrent C. difficile infection, which is like a diarrheal illness caused by a bacteria. And if it comes back over and over again, then potentially people can get a fecal transplant to kind of repopulate their gut with the right population where they don't have this illness anymore. But everything else is sort of like very much investigational. And we hear these stories of how patients have undergone a fecal transplant for that purpose, but then have had other results. Like, in that instance about hair growth, I think we've seen things where people have had a transplant from a donor who has a higher body weight or a lower body weight, and then that ends up being kind of what the patient experiences, is that their weight goes up because their donor had a higher body weight, or they lost a ton of weight because their donor had a lean BMI. Some colleagues and I had a study when I was in fellowship trying to see if there was a direct causal relationship, but it was a very short study that was, restricted to a couple months. So we couldn't see any long-term results, and we couldn't find any significant differences in weight. But we tried to basically transplant people with donor stool from a very lean person and then see if their weight would change. But yeah, no clear results.
I see. Yeah. I see. And then just like what's the most common way of actually like doing one of these fecal transplants? Is it like the little pills, or is it a different way?
Yeah, I think nowadays a lot of people are able to, the stool is processed and filtered and, be made sure that there's no transmissible conditions. And then people can orally take them, which I know sounds kind of, gross to some people, but actually it's just like taking any other kind of pill because it's all encapsulated.
Do you do like a prep kind of like you would before, like a colonoscopy before taking that type of pill? Or
to be honest with you, I don't know what the guidelines are like nowadays, but yeah.
some version of that.
Some version of it.
All right. So now moving on to one of your subspecialties, advanced endoscopic gastroenterology. In general, I feel like a lot of these less invasive methods, whether it's in cardiology or gastroenterology, have replaced like some of the big open surgeries or interventional radiology, like going back to my dad's clot, getting a thrombectomy with just like a couple of small ports with IR. It's, fairly progressive. What types of procedures were being done in a more kind of open way that like now we have the tools to do them less invasively?
Yeah. So, basically what my specialty entails is, an approach that's done through the mouth or through the anus, really, but doesn't involve external scars. And so often, like through the mouth, a lot of the procedures we do are related to the pancreas and the biliary system. And so, if you think about the way we diagnose pancreatic cancer is like inserting a needle past the stomach wall into the pancreas. And that probably at one point in history wasn't done that way. Another good example is that if there's a large precancerous polyps or even early cancer in the colon, there's a way that we can carve out the tumor without requiring people get an entire section of their colon resected, which, from a quality of life standpoint for patients, to have a big surgery, wear an ostomy bag, that's a huge difference if they're able to just get this carved out, retain their colon and go about their lives that way. So a lot of advances in that regard. And then my specific niche within that is weight loss procedures. And, there's certain techniques that we can use to suture the stomach down to a smaller size, kind of mimicking what the surgeons do when they remove part of the stomach. And likewise, sometimes when people have regained weight after initial bariatric surgery, there's ways for us to go back in and revise it to help achieve, additional weight loss. Which, sometimes surgeons are not keen on going back in because of adhesions and other kind of complications. It's a bit higher risk going in a second time. And we can help out with that.
Now, some of the work that you're doing with Medtronic also to help like advance some of these procedures so that you can do even more less invasively.
Yeah, I think that's the goal with a lot of technologies is to like, how do we, through technology, be able to detect things earlier, treat things earlier? One of the kind of historic products that we've had for the past 20 years, 25 years actually, is radiofrequency ablation for Barrett's esophagus. So basically it's like precancerous changes in the esophagus that eventually, if untreated, could potentially turn into esophageal cancer. We can go in with this device, burn the lining of the esophagus, all the cells will come off, healthy tissue will grow back in, and you won't have that risk of esophageal cancer developing. So, rather than in the past, if you had that, you might have to get part of your esophagus removed, and how traumatic that is. And so we can avoid all those downstream concerns.
Right. Very interesting. And then when it comes to weight loss, there's all this GLP-1 agonist talk with Ozempic and the others. How do you approach that? Like, especially when it comes to procedures for weight loss, when there are these medications that exist, like how do you triage patients like towards like taking a medication versus getting a procedure to make their stomach smaller? Like what is that process like?
I think that, these medications, first of all, weight loss is such a personal decision and everyone has a different goal with like why they're losing weight. And I think that sometimes there's so many different ways to go about it now, right? There's less invasive ways, there's surgical approaches, and I think they all are very complementary. I often feel like specifically for these endoscopic procedures, some patients come to me because they just don't want to be on medications, the rest of their lives, because, coming off some of those medications, you can easily regain weight. But at the same time, I feel like some of these patients who have undergone a procedure can also benefit from the addition of a medication like this. And then there's some who, after discussing all the different options say, yeah, I'd rather just do the medication. And that's perfectly fine too. I feel like they're effective and, the weight loss that comes with it confers certain health benefits that, that even if you don't get a procedure, any sort of weight loss can potentially lead to better health outcomes, better, heart health, etc.
Yeah, weight is always such an interesting conversation. And in society. You know, I think we know that, yeah, if you have more weight on you, like that could cause some health problems and all that. But then I feel like if you are out there telling everyone to lose weight, then there's also just, you know, kind of, there's less acceptance of doing that on like a broad kind of level, because you might alienate people who just, you know, they're maybe just proud of being a little bigger, or maybe they just naturally, just genetically are more predisposed to that and are not necessarily looking to lose weight. So do you ever feel like you have to dance around that topic of like kind of promoting weight loss for the sake of like, not necessarily for someone looking better, but just like being more healthy?
Yeah.
And trying not to piss people off.
Oh, yeah. I mean, for sure. I mean, I think that's why I say it's such a personal decision. Like some people, you know, feel comfortable in their own skin and there's no additional questions need to be asked. And I think that at the same time, I do try to, you know, say that, okay, there are some associations with health or with health problems, but everyone has their own, you know, what their priorities are and what their wishes are in life. And I think the big distinction for me is really the difference between, you know, promoting weight loss for cosmetic reasons. And you know, that's when I think like, okay, maybe that's not the right approach. But and if people come to me and they want to lose weight for cosmetic reasons, that's great. That's like their own preference, but it's not something that I'm going to like push a patient to do. You know what I mean? So I do dance around it carefully because I know people have different opinions about it, and yeah, it's ultimately a very personal decision.
Yeah, probably by the time they're seeing you clinically, like they're looking for some weight loss for whatever reason that it is. So it's not like you're out there trying to market yourself like, oh, come to me to lose weight. But I would imagine other doctors in the weight loss space do that, and maybe it can at times maybe come off a bit coarse to some patients who they're like, why should I lose weight? You know, like, so it's, that's always tricky.
That's a tough part about education. I think that, for any health issue, sometimes it can be a tricky dance.
So I posted to the YouTube community about, you know, this conversation we were going to have, and there were some interesting comments and questions that people posed. So if you're okay with it, maybe we can run through a few of them. All right. The first one is this, and this is just like verbatim. Does he deal with nutrition? I'm wondering, is stevia bad for the gut or other sweeteners?
Well, I am not a dietitian, so I cannot claim that I'm an expert in that. But I feel like, there's been a lot of press around aspartame and like artificial sweeteners. And I think that, there's what's tricky about that is that, there was a kind of regulatory body out there that said that listed it as a potential carcinogen, but the way that the categories are of carcinogens, there's other things that fall into the same exact category that people don't realize, like aloe vera is actually in that category. And so, you have to understand that that's, even though it's categorized as such, it doesn't necessarily mean that it has like, kind of definitive cancer risk. Generally speaking, I would say that some of the benefits of, using artificial sweeteners is that you're avoiding some of the calories that can easily put on extra weight and lead to other health outcomes. And for people who are trying to lose weight for health issues, then this is a good option. Like artificial sweeteners are not a problem. And in fact, like the health benefits that come with using them are probably greater.
Okay, this next one's a little longer.
Okay.
Please ask him to elaborate on what can be causes and solutions for bloating and digestion issues like IBS. The amount of gut health videos recently and supplements and green powders, drinks being marketed gets so overwhelming and I don't know what to do. Bloating is a constant problem for me. It feels like anything triggers it. Stress, dehydration, food, no food, menstruation, literally everything, and it's very frustrating. I even did sensitivity testing for foods, celiac disease, for gluten, H. pylori breath test, all came back no issues. I've tried Miralax, Metamucil, Lubiprostone, no major changes.
That's a tough one because I feel like first and foremost, I think that, everyone perceives their symptoms differently, and it's important to go see a doctor in person to be fully evaluated because I don't know what else is going on with this specific person's, health history. But But yeah, it can be very frustrating navigating. Everyone, I think, seems to be capitalizing on bloating. And, to this person's point about the detoxing and like green powders or whatever it is, those supplements are, and I think you speak about this sometimes too, is like supplements are not regulated the same way medications are. People can make certain health claims and get away with that. And it's, they're just not well regulated. We don't really know like what other additives are in there. Just because they're marketed as being helpful, sometimes people actually end up feeling worse on them. And, with like probiotics, for instance, there's a lot over the counter. And there's a lot of kind of confusion around probiotics. And some people find relief with them and some people don't. And it actually makes their symptoms worse. And the fact of the matter is like, we just don't know exactly what bacterial strains, for instance, are causing your symptoms. We don't know how much of a probiotic it takes to relieve your symptoms. And so it's hard to like target what those, how to treat your specific symptoms are. And for something like IBS, IBS-C, I think specifically like constipation predominant, it sounds like they've been through the gamut of a lot of workup just to make sure there's not other serious things that are happening that could be masked. But it sounds like there are still other options available that could potentially provide some relief. And also like, that's why often the doctors who are focused on this area, which by the way, I'm not an IBS expert per se, like that's not my subspecialty. But I know that my colleagues who are kind of like the heavy researchers in this area work very closely with dietitians because there's such a close relationship with food too. So it's a very custom kind of personalized, approach that needs to be taken here.
Yeah, I feel like a lot of people just rely on what's like on the web.
Yeah.
And instead of just finding a specialist or a subspecialist in that area and just like trusting them to kind of help guide you.
Yeah.
All right, next one. Why don't docs tell patients who are prescribed oral antibiotics about the need to recolonize the gut flora? I had to ask Dr. Google after needing to take antibiotics for borreliosis, and no doc I asked seemed to know how long one has to take prebiotic and probiotic foods to recolonize the gut. I'm still actively working on recolonizing after 6 months. And what about taking probiotic supplements? Does the stomach acid destroy the probiotic supplement or not? Double capsulated or not?
Yeah, so I kind of answered a little bit of that already. It's like we just don't know very much about probiotics. And when you're talking about like repopulating the gut, like how do you know when it's repopulated? Like there's no way for us to even measure specifically what repopulated means. So like what is the target there? I think that's what's difficult to answer this person's question. The reason why doctors aren't talking about it or they don't know is because nobody knows. And anyone who claims that they know is frankly lying. And so, our guidelines do say that if you're an adult or a child who's taken a course of antibiotics, that probiotics may be recommended. There are, according to our professional society guidelines, there are some strains of bacteria of probiotics that could be recommended. It's still like a very kind of conditional recommendation. And so again, it's going to require that they speak to their doctor specifically to see if in their situation, if it's worth having probiotics added to their regimen. And again, why it's so specific to each patient is because sometimes you might have underlying conditions that make it a bad idea for us to, recommend probiotics. If someone has, if they're immunocompromised, and there may be a reason behind not giving you probiotics. But yeah, in terms of repopulating the gut, there's no great way to even like measure or predictably achieve an outcome there. So I would say have a conversation with your doctor, express your concerns and your frustrations openly, and then go from there.
I feel like these areas that don't have that much great research to support a lot of the claims are like perfect areas for certain people who are far from an expert in the field to be like, I have the answer for you.
Yeah.
And it's the latest, greatest, cocktail drink that they came up with.
Yeah, it's so hard because like probiotics specifically, they're available at every drugstore out there in different formulations, but we don't know exactly like when it's right to take one versus the other, or if any of them work.
It's kind of wild, wild west.
Yeah.
Got it. Gut health and systemic inflammation. What can we do to reduce inflammation in the body naturally?
That's a tough one too. I mean, there are our bodies all react differently to different foods. And there's some foods that may promote more inflammation. And we also know, right, that like the more weight people put on, like that adipose tissue is also a source of inflammation too. So, I think generally speaking, I would say there's no special supplement or medication or special food that you can specifically consume just to like reduce inflammation, I would say, because if you're kind of leaning in one direction with your diet, you may be missing out on certain nutritional benefits of other parts of your diet. So I would say making sure that you have a balanced diet, primarily rooted in fruits and vegetables, and limiting your red meat intake and processed food intake is generally what I say.
There's people who believe in this whole like carnivore diet and other extreme diets. Mm-hmm. And my gut, no pun intended, feeling has always been that exactly what you said, that like the balanced type of diet is probably the best thing for us. But there are these staunch supporters of, very extreme diets, like only eating red meat, mm-hmm. And they just swear by that. Liver King, and his disciples and a lot of other people. I just feel like that's not the right thing, but it's hard to like prove it, maybe.
It's so hard. And I also feel like, here in the States, it's so hard to eat healthy. Like everything is ultra processed. And I also feel like, to your point about some of these extreme diets, even diets that tell you to not consume certain things, like exclude entire food groups, unless you have an underlying condition like celiac disease where you need to avoid gluten because you just have to. Oftentimes I feel like avoiding entire food groups, again, you might miss out on nutritional benefits. It might affect your mental health, just like trying to think through this like day in and day out and managing that. So I just try to say, if you can still eat things that you enjoy, even if they're not the healthiest, just like do it in moderation.
Yeah, makes sense. All right, then we have this one. Can we get a comment on this heal your gut trend on TikTok? Do I need to heal my gut? What does that even mean?
Yeah, I think that oftentimes, there's like these ideas that we need to heal something when there's nothing to heal. Mm-hmm. Detoxing your liver, like there's no need to do that. Your liver does it on its own. Your colon, like people who get colonic hydrotherapy or colonics or whatever, there's a lot of different names for this, where people basically inject a bunch of water up your colon and rinse it out. And the thing is, you eat something your next meal and it's going to come right through and it's going to, do this, have the same thing. So it's like, it's this never ending thing, and your colon is it's built to, put out waste and excrete it. So there's not a ton to do like healing your gut, unless you have a diagnosed condition. Then obviously there are specific diet that you might have to follow, medications that you might have to take, etc. Healing your gut in general, it's hard to say. And again, I think why it's difficult, and I probably should have mentioned this earlier, is the gut is so complex and it's not just one tube. There's also other organs involved in the gut. There's the liver and the pancreas. So like what part of the gut are we talking about here? Your stomach or your liver or your colon? Like it's hard for me to actually provide a recommendation. Just there's no general healing your gut thing.
Yeah, I think for many people, it helps for them to like simplify the equation.
Yeah.
So that's why all of these organs that many people may not even know exist in our systems, it gets like boiled down to like, this is the gut. When it comes to hair loss, it's like alopecia. It's like there's lots of subtypes, but like we just group them into alopecia and let's just talk about alopecia. But depending on the subtype, the treatment can be different,
Totally.
So that's, I think, one of those things that happens online, especially. And it's hard to find even the proper like lists, like Dr. Google, right? Like to find the list of like, okay, this is like everything that exists. Like it's not like reading a textbook that we've, read before. It's different. So I think people are exposed to lots of simplified information, and then it's hard for them to make decisions, and they're trying to make decisions without the help of physicians, and some people are very distrustful of physicians, and there's lots of issues related to it, sometimes for good reason, but again, seeking out experts in the field, it's very different from just going to any doctor who claims to be a specialist.
I think we're all looking for easy solutions and answers, and And, sometimes when things are complicated and nuanced, it is easy to accept something that's being sold to us as like the cure-all. And so I totally get that, because even outside of my field, when I'm going through a health problem, that's where my mind goes to, and I kind of have to check myself and make sure that I'm relying on the expertise of my colleagues.
Yeah, for sure. Austin, tell me about your new book, Gut, an Owner's Guide. What are you most proud of?
Well, on the topic of making sure that we provide people with accurate information, and it is meant for the general reader, and so it is simplified, but in a way that still sticks to accurate information, and also in a fun way. So it's colorful and illustrated. I can see, let's see, we've got an example here. And it goes through, just the basic understanding of the organs, and how the gut functions, but also the history of the field of what discoveries have been made through gut health, and then also diseases and procedures as well, which is, I think, one area that doesn't get much attention. So if you're going to go into the hospital for an office visit or for a procedure, and the doctor is feeling your belly or listening to you, what are they looking for or listening for? That's what this goes over. And after every chapter, there's actually a myth-busting FAQ section too, because we hear a lot of the questions over and over, as I'm sure you do in your field. And so it's an easy kind of reference. So it's not meant to be going into super specific depth for each patient's concerns, but it's an overall guide for the gut. So, which is why it's called Gut, an Owner's Guide.
Yeah, and you were telling me, you literally wrote the whole thing, which is impressive, because a lot of times you hear about ghostwriters and you already have so much going on, but you found the time to actually sit down and write this thing.
I thought when I first started the process and the publisher actually approached me, I was like, oh, should I get, can I even get a ghostwriter? And I thought to myself that I don't feel like I even can, because it's so technically heavy that ghostwriters often are not people who have the same training as I do. So I was like, you know what, I'm gonna do it myself, and I kind of know what people's questions are, and I know what the reliable sources of information are that I can reference. So yeah, I think hopefully people can get a good sense of the entire field in this condensed form.
Well, congratulations.
Thank you.
It's a big achievement, and I'm sure you're going to get what is it, bestseller and all of that. Everyone's going to go and guys go buy it. But yeah, no, it's amazing. It's a ton of work, but I think you and I both share this mission of trying to educate the public, and not we want to assume that the people on the other end of this have the capacity to understand a lot of big concepts, I think we're trying to get the information to them in a way that they can get it, versus I think in the past maybe it was more a little bit more of a paternalistic approach of look, I have the answer, you don't, just listen to me and everything will be fine. I think we have a different approach.
Yeah, I think that's the whole point, is empowering people out there to be better informed. When you go to the doctor, we know that you have a very limited amount of time with your doctor when you're talking to them, so it's a more informed conversation, and more efficient. And yeah, I hope that people find benefit. That's really the purpose of it, is that I just hope people can benefit from this. And it comes out April 9th, but it's already available for pre-order everywhere.
Awesome. Yeah, by the time this comes out, it'll already be available.
Awesome.
So you guys better go get it. Great. And products. So we were talking about some of the new products. We have it up on display when you come into the office.
I'm so excited for you. This is awesome.
Thank you. It is a lot of effort to get these here. Probably different type of effort, less brain power maybe than what it took to write a book.
I'm sure there's a lot of
just a lot of organizational steps, and then a lot of waiting around for certain things to happen that were out of my control. But anyway, the 6 new products are here. We got 3 for the skincare side, 3 for hair care, and you were telling me that you do normally use an HA serum.
Yes.
So I'd love for you to this is the first time he's trying this.
I get to try this? Can I open this packaging?
Yes, please.
I love the packaging, by the way. I don't know if you can see this, but there's what do you call this?
It's embossed.
Yeah,
if that's the right way to pronounce it, I think. Yeah.
And it's just simple and clean, and easy, you know?
We were going for like
simple.
a gender neutrality because I think that guys
That's
should
important.
feel comfortable, you know, trying skincare and women get hair loss. So
I'm going to try it in the back of my hand. Is that okay?
let's try it. Yeah.
Okay.
And so you have at least a frame of reference, like having, you know, used others.
This is nice. And I know like this is all like for hydration. Yeah.
Right. Exactly.
It feels really good.
It's hyaluronic acid, different molecular weights, because the smaller molecular weights are allowed to then pass through deeper into the skin, you know, because they can get through the little pores better. The bigger ones attract more water, but they stay closer to the surface. So having that blend of different, like a variety of molecular weights helps a lot.
Yeah, it feels really good. It just like, I feel like it's, you know, very light and not, you know, too sticky, and I can feel it like being absorbed already. So this is so cool. I'm so proud of you.
Yeah, we'll give you all of them to take with you.
Yeah, I'm sure people will love this product.
Cool.
Yeah.
Cool. Austin, thanks so much, man, for joining me. Thank you so much for having me. It's so good to see you again, and we'll do this again, I'm sure, in the future.
I can't believe it's been, we were saying 13 years?
At least something like that. Yeah, a long time.
Yeah.
Very proud of you, very happy for you and all your successes, and can't wait to see what's to come.
Thank you. Likewise.
Thanks, man.